Welcome to panelists.
Welcome. Good morning.
Good morning to you,
Very good
Doctor. Waiting for the panel moderator to join us, Mr. Metwally. I think he is facing a few technical issues and he will be with us shortly. We do apologize for the inconvenience. So while we're waiting for Mr. Metwally to join us, if we can just quickly have a quick round of introduction and a few words from each of you all for this discussion.
Yeah, if I may begin, Khalid Al-Khalifa from Bahrain Supreme Council of Health. Currently, my responsibility with the Supreme Council of Health is to oversee the deployment of national information technology systems, mainly as part of the National Health Insurance Transformation Program, which is being launched in the first quarter of next year. And as part of that, I'm looking over 3 main systems that we are deploying, which mainly are the national health or clinical records. We have the national claim system as well as the drug utilization review as part of our project. I'm very excited to be on the panel today to discuss very important topics around healthcare and looking forward to the discussion. Thank you.
Good morning.
Thank you. Yes, you can go ahead, Doctor. Go ahead.
Good morning, everyone. It is a pleasure to be with you all today to share an input and insight about this beautiful journey, which it will never be seeing an end. It's always a matter of discussion and insight to proceed forward. My name is Dr. Mohamed Aman. I have around a 31-year experience in emergency medical service at the government level. Currently, I'm working with Accreditation Canada as an international health system surveyor. And maybe to add to this, I can add some on board as far as other organizations which we have been surveying are doing regionally and internationally. And I can say with the visionary ombud from the Supreme Health Court or Council and the NHRA, we are with these great minds in the right way. Thank you very much.
Thank you. And Dr. Amena Malik,
Hi.
if you could give us a quick introduction as well, please.
Good morning. My name is
Amr
Malik. I am the consultant advisor to the CEO, Dr. Marimel Jalahma, at the National Health Regulatory Authority. I am in charge of the quality and accreditation, and telehealth is an integral part in the past 2 years. So we have worked a lot with telehealth. And so it is my pleasure to be here and to share with some of the findings that we have and some of the decisions that were made.
Thank you, Dr. Amena. So since we have you here, let me ask you the first question on behalf of Mr. Metwally while he joins us. So during the pandemic, there was tremendous increase in the use of telehealth across the world, right? And the facilities. How do you see telehealth being integrated into patient care?
So yes, telehealth was used a lot during the pandemic, but going forward, what is the role of telehealth? I think that's what the real question is here. Telehealth, it can be used in a combination with in-person therapy during follow-up sessions to maximize the session attendance and punctuality. It can be used with patients who have busy schedules, increased travel time, or they just want to minimize social contact. And this can impact recovery as well, since patients may get better quicker by increasing their quantity of visits and improving their compliance. What's another really important thing that we have seen in telehealth is the data that is collected from a patient that can be reviewed by a clinician during the remote sessions. And based on patient responses, the clinician can indicate adjustments needed for the therapy to optimize the care. Telehealth can be a blend, it's a good blend between in-person visits anywhere in the clinical continuum. and it can improve access to care and reduce a lot of the travel time that we see. I don't know if you're aware of the traffic in Bahrain, so it is quite a hindrance sometimes. It is convenient, cost-effective. It improves session attendance and patient follow-up care. You know, it's adaptable to patient's environment. And
can you hear me all?
Yes, Mr. Metwally, we can hear you now. I have started the panel discussion on your behalf since you were having technical issues in the interest of time, and we have Dr. Malik who's talking us through, the use of telehealth and how patients, started returning to healthcare facilities. So we started the first question with Dr. Malik. Go ahead, Dr. Malik.
So just to sort of let you know, basically, it informs the clinician and it positions you and your clinic or your medical facility for the future. That is now, Many of the on-site visits will drive up follow-up exchanges through a virtual channel. The expanded access to care provides for powerful opportunities to improve outcomes and also lower costs. So as we settle into this new normal, health systems need to consider how their point of care ecosystems should be properly adapted to fully embrace the change to achieve this new level of performance. Just as an example of what we are looking at from the NHRA level, because we are updating a lot of our standards, I was involved in making the guidelines for the telehealth that we do during inspection. And just so you're aware of the future sort of direction we're going in, we have a lot of issues. So we have a lot of we have a lot of places where we could use telehealth, for example, in the post-discharge check, medicine management clinic with a clinical pharmacist, or mental health counseling, which has now become, a big issue since the pandemic. And it's given the stigma of mental health and seeking care for counseling that's associated with that sort of the stigma that's attached to that. Telehealth will provide greater confidentiality. And what we have seen in Bahrain as well, a lot of Bahrainis live abroad and their parents live here. So when they want to include their children or their brothers or sisters from overseas, telehealth is really good to, include them into the plan of care for their older parents. And what's the last thing that we really want to go into the future with is the nurse protocol-driven programs, which basically, for the non-communicable diseases like diabetes management, those are the issues that we should be looking into for the future.
Mr.
Are you there?
Has a couple of issues again because I see that he's dropped off. Okay, I think we have him back online. Right. So, in the interest of time, we'll move on to the next question, which is for Dr. Sheikh Al-Khalifa. Being responsible for the healthcare digital transformation in Bahrain, especially in the insurance domain, what are the current policies you think it would require to be changed? And do you have or have you considered insurance companies as part from this conversation and the transformation process?
Okay. Thank you for asking about the health insurance program in Bahrain. First of all, we have the law for the health insurance was passed in 2018 that basically requires all residents and nationals to be insured. We have initiated two projects as part of that. One which is responsible for ensuring the residents or the residents program, what we call the PEACHA program, as well as we've got the Shifa fund that will be responsible for covering the health insurance for the nationals. So as part of that, we are embracing the implementation period of this project after doing extensive planning. And an important part of that is actually looking at the impact of this change on the health market, whether it's the providers or the insurance companies. As you might imagine, such a change in the dynamics of the healthcare market by let's imagine increasing the demand for private health insurance by six to eight times the current numbers, there is a major disruption to the market, including the appetite and capacity of the health insurers, as well as the capacity of the providers. And therefore, the project itself is quite fragile and at the same time requires extensive monitoring and requires consideration of how we are envisioning the development of reimbursement, whether we are considering going towards more of value-based reimbursement, which I can see is going to be a journey. It's not going to be something that is implemented in a year's time or a 2 years' time. It's going to be a journey in order to evolve towards more value-based reimbursement as part of our transformation. We have at the moment an engagement with the health insurers in order to further understand their capacity for digital transformation. As part of the law, there's a requirement to have digital transformation within the whole sector. We developed, as I mentioned in the introduction, a claims platform, which requires both the health insurers as well as the providers to submit claims by providers and by the health insurers through those systems that we are providing. The advantage of doing that is that we will be able to collect the data required in order to transform our health reimbursement towards more of a value-based care. I think that the journey that we are taking requires not only information that will be captured through the health insurance, but we are also targeting more of clinical and quality indicators that are going to complement what we have at the moment. Besides that, I want to mention that we are engaging with health insurers to capture the enrollment and ensure that there is
in Qatar
to have accessibility to or access to health insurance, and therefore all the health insurers are expected to provide their enrollment information through a portal that is being designed at the moment. So yes, as part of, just to respond to your question, we are engaging with health insurers. We're trying to understand how to best implement that without making a major disruption, given that the transformation itself is quite huge and going to impact the whole market. Just to touch on the topic of our panel discussion regarding the telehealth and the telemedicine, these are, again, things that will be required to be included as part of our financial model, how we will reimburse those activities. And I think that the maturity of the market will help in including these vital channels that complement our targets of value-based care. Thank you.
Thank you, Doctor. So moving on, we have a question for Dr. Mohamed Aman. What is the needs assessment for virtual health services? Is it needed, and have the concept ever been proved, or what is the design and the co-design for the same? Dr. Mohamed, towards the left-hand corner of your screen, you will see a small little microphone. Yes.
Good afternoon, good morning, every colleague. It's my pleasure to be with you today here. I think telehealth, telemonitoring, and teletechnologies has proven the concept thanks to the, let's say, the Corona COVID-19 pandemic to bring all this to the light. The Corona COVID-19 pandemic has proven the concept of the telehealth technologies in a very well manner. The only maybe drawback of this, it was a reactive rather than a proactive proof of concept, but nevertheless, it is there now. Yes, the time has come to adopt the telehealth technologies from all perspective. It will enhance the accessibility of the patient care for the patient, given the concept as well of personalized or people-centered care, which is being adopted as the mainstay of the accreditation standards all over the organization globally. It will enhance the involvement of family and community members in the care of the direct care of clinical encounters, which is a crucial point of care segment, which has to be tackled in an appropriate way. But yes, the proof of concept it has been there, and moving from this point, I would say in designing any healthcare services, the concept of design and co-design is approached in a proactive way. In designing any, let us say, any healthcare delivery services, we will have to involve the patients, the family, and the people from the outset of the design itself. I think this is one of the take-home lesson we have learned, and it applies also to the regulations of the service. The co-design with the major stakeholders of the care process is very important. Yes. Yes, the floor is yours.
Thank you, Doctor. We move on to Dr. Malik for our next question. What are the regulatory challenges we face in the telehealth industry today? Doctor, you're on mute.
You're on mute is probably the most common phrase after COVID.
Happens to the best of us, Doctor.
Yes, sorry about that. I just was saying that, I think that everyone is aware that NHRA, under the leadership of Dr. Mariam, is very progressive, and we're looking to make telehealth standards and the service accessible to everyone, because I think it's very valuable in this day and age. And it has shown and proven to be, to be useful in the scenarios that we have seen. So just some of the challenges that we have faced just in terms of providing the service of telehealth. As my learned colleague said from the Supreme Council of Health, one of the biggest challenges is coverage and payment. Until it is fully accepted by the government and by the private insurers and parity laws, that the parity laws are implemented, providers and healthcare instructions may feel that it does not make financial sense. So we sort of face that hurdle when we go, especially into private facilities. From a regulatory standpoint, as you all know, health professional licensing, what's the portability of a medical professional's license when it comes to telehealth? Can an expert from another country provide telehealth services in the kingdom without a local license in collaboration with another facility, for example? So we have those kind of challenges that we're looking into to see how best we could address these kind of licensing issues. Another big one is credentialing and privileging on the basis of the level of the facility that's providing this service. This goes along with licensure too. So how are we going to regulate what areas a practitioner can advise care in an online forum? Which governing body in the country will make sure they are privileged for this service? So we need to figure all those things out. Another huge issue is online prescribing, which I think is a worldwide issue. Currently, this is not allowed in Bahrain. You cannot prescribe through the telehealth portal. It has to be through a proper consultation, which is face-to-face, and then you can provide the prescription. But in order for patient to get that maximum benefit from a telehealth consult, is this required? So we have to ask ourselves these questions. So should a prescription be allowed without completing a physical exam? I'm a physician myself, and I'm not really sure I'm for that. Very much about, interacting with the patient, feeling the patient, doing a proper physical exam. So I feel like those are some of the challenges in online prescribings. And how do you guard against abuse as well, when you're doing that? Another big issue, because in NHRA we deal with complaints and we deal with medical malpractice, the legal liability of telehealth, the liability insurance. Do providers need a separate liability insurance? It's too early to tell right now, but we need to answer these questions before we sort of full out go ahead and go with it. And then I've been working with cybersecurity just to incorporate their standards in the national cybersecurity standards into our accreditation standards. And I found that, in telehealth, we need to ensure that there's a secure platform, there's secure documentation. Poor connectivity, for example, like today, what we can see, poor connectivity can impact the way a message is even being communicated. So it can be misunderstood. And if you're looking at elderly patients, how can they understand you? Sometimes we have a different accent, sometimes we have a different dialect of Arabic. We have to make sure that these hurdles are passed before we go fully for telehealth. And finally, fraud and abuse, billing for services that are not rendered. I mean, this is even at the hospital level or at the medical center level, but this would be, one of the challenges that we would have to face in regulating telehealth here as well. So I think it's a lot of work left to do, a lot of answers that we need to many of the questions. But the best thing about Bahrain is, NHRA works closely with Supreme Council of Health. Supreme Council of Health, all of us, we work closely with cybersecurity. So we are a good cooperation that do work together, and hopefully we will answer most of these questions together.
The next question would be to Dr. Aman again. Quality first is a must, right? So what are the standards and best practices that are followed to maintain that high standard of quality?
Okay, I think this is for me, I guess, because there was a segment which is missing from the audio. In Bahrain, we have the NHRA, the National Health Regulatory Authority, and we have the Supreme Council Court for Health, which are the regulators of the health services in Bahrain. And as far as I know, correct me, Dr. Amina, on that, I think the NHRA is having a virtual health standard as far as the telehealth care is concerned. So yes, the quality best practices adopted in this essence is as a regulator in the hand of the Supreme Health Council and with the NHRA. And that's the way ahead to go and proceed with it. Yes, there are a lot of international bodies, but we are binded by the local authorities. And this best practice adoption is in the hand of the regulators, and they are in the good track and good way to proceed further with this. Nevertheless, any standard which has been put is amenable for reviews by time. It's not bulletproof. It's not final. That applies to any other standard all over the globe. So the machinery, the infrastructure, the quality and best practice adoption for delivering a health or a virtual health is there in place. And I think locally in Bahrain, we are in the right track. Thank you very much.
Can I just clarify something?
Sure.
Just to talk, at the NHRA, we do have telehealth standards. We have two types of licensing. You can offer telehealth as a service, or you can be kind of like a free-standing telehealth facility. So we do have this standard of quality that we do expect, not only from the inspection perspective, but even from the accreditation perspective. So it's a two-way thing.
Thank you very much, Dr.
Thank you, Dr. Malik. Moving on to the final question that we have is for Dr. Al-Khalifa. The second question I think is very relevant when it comes to the costing formula that you would adopt when dealing with insurance schemes? In fact, is it a value-based, or is this some kind of a new enemy for insurance companies? And can it be easily abused as well if the right policy is not adopted?
Yeah, I think this is kind of at the heart of the issue, is how to balance our implementation of the health insurance program. And therefore we are really working close with both stakeholders. We're working with the health insurance as well as the providers in order to formulate our costing based, or our pricing for the services, as well as basing that on actual cost information. And I think this is kind of the approach that we are taking, which is going to, let's say, put the basis on the data that is being captured. And where we are starting is the data quality. This is where we need to make sure that whatever data we are capturing is actually of higher quality, because if the quality is bad, we will impact the outcomes or the findings that we have. And this is very sensitive when it comes to financial implications, when it comes to measuring our outcomes. And therefore, there is quite a major emphasis in our program on collecting of data, but the data needs to be of high standard and high quality. Our intention is to trigger a lot of the important aspects of value-based care. I just want to touch base on an area of interest of mine, which is patient engagement. I think in healthcare, the biggest resource that is underutilized is the patient. We need to really work on engaging patients. The digital platforms that are available today, whether it is telehealth, remote monitoring, if we go to more extensive applications for patients that will allow better outcomes, I think that is something that we, in the long term, need to kind of emphasize as part of our reform, as we believe that costs cannot be controlled just by doing financial reforms or putting policies that do not actually maximize the other aspects of the care provisions and the stakeholders that are there. The final area that we feel also that is very important, that is part of our program, is aligning the care continuum, linking the primary care, maintaining the link between primary care and secondary care, and making sure that this is seamless to the patient, and this is something that the patient can have as long as he is moving along the care journey. So we are really, it's a major transformation that we are doing that involves many pillars, but we are really looking forward to achieving the outcomes that have been set as part of the program. Thank you. You're on mute.
Like I said, it happens to the best of us. So I have another question from the participants, and any of you can pick this question up. This is more to do with insurance. So what are the standards for common health insurance platform in Bahrain, and is it available online so healthcare providers can prepare themselves?
Yeah, I can take this question. Actually, the standards that we are developed as part of enrolling into both the claims portal as well as the enrollment portal. I would not say they are published at the moment, but they will be made available to the health insurers very soon as part of our announcement for the rollout of the PCHIP program, which is the residence program. So I would say that at the moment it's not available, but definitely very soon it's going to be available on our portal that we would share with the insurance companies.
Thank you. I hope that has answered the question for the audience. And We have another question. I'm not too sure if this is relevant, but if any of you all have any knowledge on the topic, if you could please share with us your experience. I'll go ahead and just read out the question that came up. So this was from Prakash Dimelo, and his question is, he would like to know how hospitals are managing patient data due to the data protection laws in Bahrain, right? And under this law, patient data is personal and sensitive information. So, would any of you be able to address this question? I'm not too sure how relevant it is with
Yeah,
the subjects, but if anybody could please address this question.
I can comment on this. I think each institutions or healthcare facility has its own policy for the privacy and confidentiality of the patients and clients. But this is already regulated at institutional level and with an oversight from the concerned regulatory authorities. That crucial point, I can agree, and that would not be overlooked by any healthcare organization because protecting patient privacy and confidentiality is one of the ethical regulatory issues which should be observed. Uh, in that sense, it's not a concern that's addressed at the institutional and regulatory levels. Thank you.
So I could comment on that from the regulatory standpoint. So what it is according to our standards, every facility needs either a cloud-based portal to save their data. They must be the owners of the data, not the cloud. And we are very strict about who has access to that data. We do look at the levels of different access. I mean, even within a facility, the doctor's access is separate from the nursing access to the pharmacist access. So there are various things that we look at in regulation in terms of data, patient data. That's what I'm talking about. Now, when you talk about the confidentiality and the way we do things in Bahrain, I can tell you, and I'm pretty sure Dr. Sheikh Khalid can also agree with me, we are becoming extremely strict about cybersecurity, and it's come to the point where we have all come together to write out the new standards. We've all had an input on these standards, not only from the healthcare standpoint, but even from financial, for example. Every area in Bahrain in the government sectors have had an input into this data management. So I think we're on the right track. I think that we are definitely in the right track. We might be a little bit immature, but we are definitely maturing very fast.
Yeah, just to add, the National Cybersecurity Center is working on specific document for healthcare cybersecurity. I think this is going to be effective very soon. So that will only add more levels of security, but I think we're getting there. Yes, I agree with Dr. Malik.
Thank you. Right. So I think I don't see any other questions, which would bring us to the end of our panel discussion. Thank you, Dr. Al-Khalifa, Dr. Malik, and Dr. Aman for your insights and the knowledge that you've shared with us this morning. I also thank Mr. Metwally for his support, and I think he had some technical issues due to which he couldn't join the panel and he was dropping in and out. But I thank all of you all for your valuable time, your insights, and the knowledge that you've shared with us. Hope you continue to have a great rest of the day and enjoy the rest of the subject. Thank you.
Thank you very
Thank you.
much and have
Thank
a
you so
nice
much.
day.
Thank you.